This is going to be video 1 in the heart anatomy series of videos. So to begin with, what I'd like to do is go ahead and go over the structures that you see externally on the heart. And so this structure right here, this is on the right side of the heart. This is the right auricle. The auricle is the external feature that encloses the atrium, which is the chamber inside. So this is the right auricle. On this side, you have the left auricle. Over here you would have the right ventricle, which is actually a chamber inside, so I'll open that up so you can see in there in a second. And on this side you'd have the left ventricle. The blood vessels that you see, this blood vessel on the right side is the superior vena cava, and it's going to deliver deoxygenated blood into the right atrium. If I turn it a little bit this way, down beneath, this is the inferior vena cava, which also carries deoxygenated blood into the right atrium. The pulmonary trunk is located here, and it is bringing deoxygenated blood out of the right ventricle. The pulmonary trunk will branch into the right and left pulmonary arteries to carry the deoxygenated blood to the lungs. The vessel that you see here is the aorta. So the first part would be the ascending aorta. Across the top would be the aortic arch, and then the descending aorta would continue. This is just what we have on the model, but the descending aorta would actually continue down behind the heart and continue down through the thoracic cavity and into the abdominal cavity as well. On the back you see what I had pointed out earlier. This would be the left pulmonary artery. This is the right pulmonary artery. And then the pulmonary veins are what you see here and here. They're the red vessels. The left pulmonary veins and the right pulmonary veins carry oxygenated blood from the lungs into the left atrium. So if I were to pop this open, this is actually the left atrium within here, the chamber on the upper left side of the heart. You also see, if I go ahead and lift it and turn it this direction, right here, this is the coronary sinus. So the coronary sinus is actually a vein, and it's going to open into the right atrium. So it's carrying deoxygenated blood from the myocardium itself and returning that blood into the right atrium. So blood from these other coronary veins travels through the veins and then ultimately into that coronary sinus. So the large coronary vein that you see on the front of the heart is called the great cardiac vein, and it carries deoxygenated blood from the myocardium into the coronary sinus and then into the right atrium. The red vessels that you see on the front of the heart, we have the right, let me open this up so you can see it. Right here, this is the right coronary artery, and this is the left coronary artery. The right and left coronary arteries branch off the base of the aorta. So you can see that right there, where the right coronary artery branches off the base of the aorta. You can't see where the left one branches off with this model because of the way the model is constructed. But both the right and left coronary arteries carry oxygenated blood to the myocardium. And then the left coronary artery branches into two main branches. We have the anterior interventricular artery here, and then the left circumflex artery is here. You might be able to see that tiny number 5 right there. So again, the left coronary artery branches into the anterior interventricular artery, which is the vessel in red, and the left circumflex artery, also the vessel in red here, both carrying oxygenated blood to the myocardium itself. So the last thing I want to do is to show you to identify the vessels that come off the top of the aorta, and then we'll close this particular video out and we'll move on to the internal structures in the next video. So the first branch here coming off, it would be on the right of the aorta. It's on our left as you're viewing it, but it's on the right of the aorta. This is the brachiocephalic trunk. The branch in the middle is the left common carotid artery, and the branch here on the far left is the left subclavian artery. Off.